Hi everybody, this is Dr. Misha Kogan. Welcome to my channel. So today I'm going to show you how to do a B12 injection at home. I'm going to show you with a real patient, and idea here is since we recommend at the center B12 shots all the time, I decided instead of looking on YouTube that I will show it to you myself. So what you need to do, you need to have your B12. Now B12 can come in a vial like this, which is a bottle that's often actually the cheapest form and sometimes even covered by insurance. You need a syringe. Here I have what's called sometimes a diabetic syringe, 1 milliliter syringe with a needle. You need alcohol prep to clean the skin, and I also like to have a band-aid on a rare occasion there's a drop of blood. You don't want to stain the clothing. If you have pre-filled syringe, which many of you will have since this is often how we order the injection, then you're basically skipping the first step. So the first step is to invite your patient, and thank you so much for coming. The second step is really you open the vial, so you take this cup off, you just click it off, you take a syringe, you cap it, so you put the needle on if you have to. If the needle is already on, you don't have to do that. And then what you do is you invert the bottle, you put a little bit of air inside, about maybe a half a milliliter, and then you draw everything that's in the bottle. In this case, it's a 1 milliliter in. You do need to know your dose. If you have a multi-vial bottle, then the process is a little bit more difficult, but I'm not actually going to show you this because we rarely, actually we never prescribe multi-vial bottles for any of our patients, simply because the process is a little more complicated since you have to clean the top of the bottle between each injection, and then there's some sterility concern if you don't follow the protocol. Okay, so sometimes what happens, if you look at the end of the syringe, which is perfect, you can have some air left. So you have to make sure air is not in there. You have to very slowly press on the plunger until you get all of the air out. If you lose just a little bit of vitamin B12 in this case, that's no problem. So you start seeing a couple drops coming up, that's totally fine. So now the syringe is ready for the injection. So now hopefully your patient is ready too. So you ask the patient, or if it's yourself, you just lift up a shirt or whatever it is, just so that you have enough abdomen. You can see that this patient has a tattoo. Make sure you don't inject into a tattoo, just not to cause any reaction. So I would pick the other side here. I would clean it once. If you want to be really thorough, you want to do it twice. So, I generally recommend that everybody wear gloves, but if it's you yourself at home and you don't have gloves, you don't have to wear. This patient appears to be related to me, so we're going to skip the gloves. But what you do is you grab the skin like this, and you put the needle right in. Make sure you don't have to put the needle all the way in. You just want to pierce the skin a little bit, and then you inject. You don't have to draw back how it's sometimes done in other injections that are deeper. You just want to put all of the fluid in. Now it's important that when you're ready, when it's done, that you stabilize the skin and you pull the needle quickly out. That minimizes the pain. Now notice there's a little bit of a drop of the B12 coming out. So in that case, this is what the band-aid is for. So you want to put it on, and sometimes there will be a drop of blood. None of this is to be of a concern for you. Most of the B12 that was injected is going to go into a patient and she's going to feel better. So there we go. And that's the entire process. Stay tuned for more videos. Thank you, everybody.